In this presentation, we will be discussing the critically appraised topic of aquatic therapy and stroke recovery. Presenting will be myself, Kevin Frazier, and my colleagues Joseph Chow, Stephanie Marshall, and Brianna Wilson. We're MOT students at Texas Tech University. And stroke is a fairly common medical emergency. In fact, according to the Center for Disease Control and Prevention, 130,000 Americans die each year from stroke. And it is second only to ischemic heart disease as the leading cause of death in the world. And that's based on a report by the World Health Organization, which was updated in May of 2014. Stroke itself causes many changes to the brain, including motor impairments. And these impairments involve paresis, muscle tone, lack of selective motor control, abnormal reflexes, and poor balance. These motor changes affect the individual's ability to participate in meaningful occupations such as activities of daily living, social participation, work, play, and leisure activities. Post-stroke occupational therapy is needed during rehabilitation to assist the individual in returning to these occupations. Aquatic therapy is a mode of therapy available to occupational therapists as they assist individuals in stroke recovery. Aquatic therapy is known by many other names. In our research, we included the terms aquatic therapy, underwater, hydrokinesiotherapy, hydrotherapy, in water, and water-based. Water has properties that assist in rehabilitation, including assistance in the form of buoyancy and resistance in the form of drag. These properties enable a therapist to apply therapeutic use of occupation to improve range of motion, strength, and endurance. To date, little research has been done to demonstrate the effectiveness of hydrotherapy for specific conditions, including stroke.
In our research, the PICO question we asked was, what is the effectiveness of aquatic therapy on adult stroke recovery? We left recovery as a broad term because we found that researchers tested a variety of outcome measures to determine the level of recovery. As you see here, in the 16 articles we reviewed, there were 13 different outcome measures tested to measure recovery. Of those 13, most showed positive results, while gait and strength showed mixed results. However, of the 2 articles that examined gait, one showed improvements over time, while the other showed no effect in more immediate changes. In regard to strength, the research using torque as a measurement showed improvement, while the study using workload showed no change. Overall, we found that some articles looked more at functional abilities such as ADL performance and functional movement, while others focused more on individual motor components necessary for meaningful activities.
Next, we are going to talk about the effectiveness formula. The effectiveness formula was taken from the 2011 Occupational Therapy Research Agenda that was put out by the American Occupational Therapy Foundation and the American Occupational Therapy Association. The idea behind the effectiveness formula is that the more researchers in the field can describe an intervention, the better people will understand why an intervention works and how it can be implemented into practice. For those studies that are deemed ineffective, the detail that the effectiveness formula provides can also help guide what changes can be made for future research. So for the effectiveness formula, optimal dose plus frequency plus duration plus location plus active ingredients equals effective occupational therapy intervention. The dose is how strong the intervention is. The frequency is how often the client participates. The duration is the length of the intervention. The location includes the best places for intervention. And then the active ingredients include therapist actions, meaning what does the therapist do to guide treatment, and then targeted skills and functions, as well as client response, meaning how did the client respond to the intervention given. So for the 16 articles analyzed, the dose was not clearly defined. However, the presence of water, the depth of water, and the intensity of exercise were identified as possible doses. For the frequency, there was quite a bit of variability, as you can see here. We took the time to break it down for you, but the most common frequency was 3 times a week for anywhere between 6 and 12 weeks. Next, we have duration. The duration for most of the articles was reported as treatment time. The most often treatment times used were 35 minutes, 40 minutes, and 60 minutes. The location of the treatments included aquatic pools of labs, clinics, hospitals, and community centers. As mentioned before, the active ingredients are made up of therapist actions, targeted skills and functions, and then the client's response. The therapist actions were not explicitly described. However, most articles suggested the therapist supervised, instructed, and made environment modifications. As you could probably tell by the summary of results mentioned earlier, the targeted skills and functions varied greatly. Also, the client response was not reported in the majority of studies. For the 2 studies that did describe the client response, one stated that there was a positive response from the client. The other study focused more on the common complaints, which included feeling cold, being tired before or after therapy, the floor being wet, their body being wet, and then the fear of being in the water.
So to summarize what we have learned so far, here we have a case study of a 58-year-old male who has suffered a right CVA. During our initial evaluation, this client showed decreased ADLs due to decreased functional movement, coordination, joint mobility, postural control, proprioception, strength, and the presence of spasticity. Also, our client showed gait abnormalities and decreased cardiovascular fitness and endurance. Our intervention is aquatic therapy. The frequency will be 3 times a week for 6 weeks. The duration will be 40-minute sessions, and this will be located at the clinic pool. The overall outcomes after aquatic therapy, our client showed improved ADLs due to increased functional movement, coordination, joint mobility, postural control, proprioception, strength, and a decrease in spasticity. Our client also showed improved gait and improved cardiovascular fitness and endurance. Even though all problem areas have improved drastically, please keep in mind that this is only a hypothetical case study. In reality, the patient may not show increase in all problem areas.
So what you're going to see in this quick video are the potential outcomes of aquatic therapy.
So Chuck can walk pretty consistently for 30 minutes at 1.5. Wow. For 30 full minutes. Yeah, we used to put weights on him because his leg would float, so after the stroke, of course, he didn't have a lot of control over his left side. But after walking on the treadmill all this time, he doesn't need the weights anymore. And in fact, we used to put a weight on his left arm, and it would hurt because it would distract the joint and open it up, but now we don't even do that anymore. Okay, we're going to slow you down, Chuck. When Chuck first came, he had so many things to work on, and one of them was balance. And we'll show you now how well his balance is. So walk backwards for us, Chuck. I mean, to walk without hanging on to anything was a major accomplishment, backwards besides. And he's very balanced now. Now, Chuck, can you do 3 or 4 jumps for me? Jump. Jump 2. Jump 3. Jump 4. And jump 5. Now, can you sidestep back this way? This is another very difficult skill that he can accomplish on his own without any assistance at all. It's amazing. It's amazing.
So as you can see, aquatic therapy was able to help improve Chuck's balance, his gait, and likely his cardiovascular fitness and endurance as well, as evidenced by when the woman stated that he was able to walk for 30 minutes at 1.5 miles per hour, which I'm sure was probably quite difficult for him when he first had his stroke. And with that being said, since he's having improvement in all of these areas such as gait, balance, and cardiovascular fitness and endurance, it's likely that he's also having improvements in his ability to perform certain ADLs. If you're interested in watching the entire video, we will provide a link down below that you can take a look at when you have time.
In conclusion, aquatic therapy is promising as an effective treatment for adult stroke recovery. More research replicating current findings in aquatic therapy with strokes needs to be done to determine the effectiveness of this treatment protocol and to validate the findings.
If you're interested in learning more about our critically appraised topic on aquatic therapy and stroke, we encourage you to take a look at the link down below. It gives a full summary and description of all 16 articles that we analyzed, including both the effective and non-effective interventions. Here are the references of all 16 articles that we analyzed.